Greetings, families. Welcome back once again. I hope you are well. I hope your day is good. Thank you so much for clicking on this video. This video is about Burkina Faso. The Burkina Faso health minister has surprised one of the villages. Recently, he has been visiting a lot of villages that are close to riverside because of malaria. They are vaccinating a lot of children, those who are vulnerable to malaria, and also distributing mosquito net to most of them. This hospital was not expecting this visit. Families, watch and listen to what happened there. I'll be back. Thank you for your time.
By the Minister of Health to the health centers in Bobo Dioulasso to ensure that on-call duty was actually being observed. He repeated the exercise during the night from yesterday to today at the Saba Medical Center, the Nyoko CSPS, the Kosoro Medical Center, and even at the Algado Uedraogo. He took ownership of the organization of work in these places, encouraged and congratulated the guards, Frank Wedrogo Musaki. Saba Medical Center in the middle of the night. The Minister of Health, accompanied by his close collaborators, is here to ensure the continuity of services and ongoing care from the clinic to the maternity ward. Staff are at work at the Nyonko CSPS and at the Kosodo Medical Center. Men and women are on the front lines to bring smiles back to patients. The same observation at the Algado Uedraogo University Hospital.
We made this visit, which allowed us to see healthcare workers on duty while others are sleeping or doing something else. They are here, keeping watch, watching over the health of Burkinabe people. And I truly want to congratulate them, to acknowledge all the merits of these healthcare workers who sometimes in less than optimal conditions ensure the continuity of care.
It encourages us, it also gives us a boost to really commit ourselves to our work. And it also shows us that the ministry is with us.
In each health center visited, Dr. Robert Lucien Jean-Claude Kagogo speaks with the staff on duty and encourages them to show greater professionalism and patriotism in their work. But this nighttime visit also makes it possible to detect malfunctions in certain health services.
We noticed that some healthcare workers have their names on the duty rosters, but are not actually present during their shifts. We also observed situations where these duty rosters, which should be properly posted and signed, did not exist. We also noted situations where the working hours required by the hospital public services, 35 hours, were not being respected. Disciplinary procedures will be initiated against those healthcare workers who do not comply with the rules related to duty shifts.
We had a surprise visit from the minister himself right around 1 o'clock in the morning. We are very honored. It was the duty team who came by to check the effectiveness of the shift. And fortunately, we have been implementing this for a long time.
The Minister of Health was given a tour of the consultation rooms, operating theaters, in short, all the healthcare facilities here. It was an opportunity to assess the working conditions of the staff, but for these men and women, there is an urgent need to increase their numbers in order to effectively meet the healthcare needs of the Burkinabe people.
Thank you so much, families, for listening and watching. I was surprised, just like many things, that nowadays, now, President Captain Ibrahim Traore has been in power for 2 years now. They know how things are changing. They know the revolution that is taking place. When I say they, the workers everywhere know what is going on, that he means business, the ministers means business, even though if they don't get to you, they are expecting you to do your best to support the economy in every sector that you are. Do your best because you are paid to work. I was shocked to see what I saw because I can imagine this happening in A lot of countries, but not in Burkina Faso, not right now, no. And yeah, when it comes to hospital, it's close to my heart. I have experienced things in hospital that I cannot explain. So I was just imagining those children, those mothers, those fathers that came there with their children, thinking that there will be someone responsible to look after them. And then these people just put their names down and left, or do not even come. But those of the nurses that are there has put their names down, vice versa, because you help me, I help you. And I'm hoping that the director or the manager on duty that day will be held responsible, because it shouldn't happen. Whether under President Ibrahim Traore or not, it shouldn't happen in anywhere, any country. But I know with my own experience that is happening. And these nurses, just like police that receive bribe and all, they should be ashamed, because they sign up to protect individuals, to protect the citizens. And these are vulnerable people. You are not on duty. Look at the environment, how the papers just scattered everywhere. It doesn't look like hospital. Whew. Yeah, I can talk and talk a lot about this, because I had an once again experience in Ghana with my mom. It's not easy. I mean, you can see nurses on their mobile phone and they don't care who is coming, who is going. The world is busy. People are on the floor. They don't care. Anyway, I've had another video, maybe one or two, to this, how they are distributing the mosquito net to protect them so they will not end up in places like this. I'll be back, families.
The Minister of Health, who is now in the Bizega province, he was there yesterday morning to observe the campaign for distributing long-lasting insecticidal nets. The operation has been underway nationwide for several weeks, and at this stage, the authorities note reasons for satisfaction. We see this with Adamagiti and Lambert Suma. The Minister of Health is concerned about how the distribution of long-lasting insecticidal nets is being carried out in the commune of Commissary. Lucien Kagogo was able to see that the operation is going well overall. All stages of the campaign are being carried out according to the schedule. The guidelines are being followed to the letter, right down to the posting of implementation costs.
We have coverage of around 91%. A little over 1,000 insecticide-treated mosquito nets have been distributed so far in the Konyudu CSPS wing and across the entire Commissary Health District. A little over 100,000 long-lasting insecticide-treated nets have been distributed, which amounts to about 91% coverage.
Since the implementation of malaria vaccination in children, the health staff at the Konyudu CSPS have not recorded any new cases among them. This achievement has been praised by the supervising minister as well as the technical and financial partners supporting the implementation of this mosquito net distribution operation.
First, it is necessary to ensure that the mosquito nets that have been procured are of good quality. We are helping the government ensure that these mosquito nets, which were first sent to Burkina, are of good quality. It should also be noted that the technical and financial partners have contributed greatly to the procurement, that is financially, to the acquisition of these various mosquito nets.
The World Health Organization recommends that countries with a high malaria burden should benefit from a distribution of long-lasting insecticidal nets every 3 years, with each household receiving one net for every 2 people. The goal this year is to achieve a usage rate of 80% for LLINs. Doctors of the world are scrutinizing the policies of West African states regarding sexual and reproductive rights and health. During a workshop that concluded last Friday in Ouagadougou, the network reviewed the achievements and challenges of the SAB region's commitment to the well-being of young people. The meeting helped strengthen the synergy of action among stakeholders in the field. Hello, Basui.
Of young people and adolescents are at the heart of this meeting in Ouagadougou. The initiative comes from Doctors of the World, This session will allow participants to focus on the commitments made by the top officials responsible for health and education in 25 countries in West and Central Africa.
Today, we are meeting here to concretely review what has been done between 2023 and 2025 to ensure continuity and to see what commitments have been made by the various states to guarantee ongoing support and engagement in advancing this initiative at the regional level.
We, the youth, what we're asking for is to be informed, to be listened to be trained, and above all, to be included in decision-making bodies that concern us.
Coming from the sub-region, such as Benin, Côte d'Ivoire, and Burkina Faso, these men and women will contribute their part to the development of young people and adolescents. The meeting aims to find solutions related to their education and health.
These commitments aim to address major issues such as early pregnancies, child marriages, infections, the use of psychoactive substances, sexual and gender-based violence, and the low level of education, which unfortunately have a devastating impact on the economic and social development of the region.
The technical and financial partners expect recommendations from this workshop to ensure the effective implementation of the projects. This meeting benefits from the support of members of the technical working group who assist the states in their country consultations.
Thank you so much, families, for listening and watching. You can add your experience to this one. For mine, I have a lot because hospital is a place that, many at times I'm there with my son, myself, and all that. So yes, I have many experience, but I'll bore you with it. If you have one that you need to share it with us. Share this video. Those nurses should be ashamed. If you are a nurse, please do your duty. You sign up to help, so help. If you are doing it because of money, then this job is not for you. Don't neglect the needy. Don't neglect those who need your help. And even if you are not paid and you are there, we have volunteer carers. We have volunteer nurses. If you are one of them and you know you are not interested, don't do it. Don't do it, please. If you know someone who is doing that, don't support them. Report them. I said report them because what happened to me that I shared not too long ago, I didn't report the people because the pain my son was in. All I was thinking is about him. I wasn't taking names of them, but looking back, I wish I did. And I will never repeat that again. Anyone that will cross me on that side, I would report that person so it won't happen to anyone again. So please do your jobs. That's all I can say. Thank you so much, families, for your time and your support, your contributions under the comment section and everything you are doing on this channel. Thank you. God bless you all. I'll be back. I'm having some technical problems, so you can tell I'm not regular, but I'm working on things. Hopefully, I'll be fully back very soon. Thank you for your time. Having said that, I have some videos about Mali. I'll share it with you soon. See you soon. Credit to our TB News and Faso 7. Bye-bye from this.